In the early part of Barack Obama's first term, one of the most hotly debated issues was the Patient Protection and Affordable Care Act, also known as ObamaCare. Now that President Obama has been elected for his second term, it appears the law will stand. So what does that mean for us? I spoke with Dr. Alon Peterson, who practices here in Hastings.
Each state is required to create insurance opportunities for members of the state to purchase health insurance that will be subsidized with vouchers based on their personal income.
Dr. Peterson, who works here at Regina Medical Center, says that this is a necessary step for America's healthcare system.
Taking care of those without insurance is one of the greatest barriers for them getting the care that they need. And in the hospital setting environment where we're at, we know that that's one of the drivers for many folks ending up in the hospital because they don't have health insurance and ability to access care in the clinics or with a primary care physician, or what we sometimes call a medical home.
Joanna Bears, who recently ran for Minnesota State House, agrees with Peterson.
I do know that there's three main things that are really good about the Affordable Care Act, and that's for kids to stay on their parents' health insurance until they're 26, and people not being able to be denied health insurance based on a pre-existing illness. My brother was born with Legg-Perthes disease, a hip disease, and then at age 12 it developed. Luckily enough, he was able to go to Shriners, but at 18, once he was done, if he didn't get an employer or didn't go to school, he wouldn't have been able to get health insurance on his own because of his pre-existing illness. And then the lifetime cap, having that taken out, and that's going to be huge.
Minnesota State House Representative Denny McNamara believes the law has pros and cons.
More and more kids, it's taken longer to get through college. It's important that they have health care, and that's a really good feature of the ObamaCare. The other thing about the pre-existing conditions, it's important that just because someone's unfortunate, might not be as healthy as you or I, they deserve to be able to purchase health insurance. But there's just too many mandates. We've heard from too many small business people that say they're going to pay the penalty instead of having insurance for their employees.
Tony Alon, who is on the Hastings City Council, says he is less concerned with the healthcare system as long as everyone is receiving healthcare.
That's why I'm not particularly married to the system of Obamacare, and it's not why I'm particularly opposed to it. I think I'd rather see it in action and try to fix what we've got rather than try to scrap it and start over. But that said, if there are other interesting ideas out there, let's hear them, let's put it on the table. But let's make sure that everybody's getting covered, especially if we're going to have elected officials covered for life, you know, in Washington, D.C.
So when will we start to see changes?
Some of the things that you've already seen taking place that folks are benefiting from already are for young adults. They are able to stay on their parents' insurance until age 26 unless they become eligible for another insurance product through their employer or through their spouse's employer, and then not being able to be excluded from your insurance because of a new condition or pre-existing conditions. Some of those have already taken place. The big one coming is going to be the individual mandate and the insurance exchanges through the states. That'll happen in 2014.
Dr. Peterson says his hospital is already making changes to prepare for the increase in patients and lower reimbursements.
The triple aim, which is to improve the patient experience, which means quality of care that they receive. The second is how do we improve the health care of the population? And much of that is by that question of access to insurance products so that you can get access to health care. And then the third is how do we reduce the costs of care?
But not everyone is excited about Obamacare.
Look, we all know that people aren't denied health care in America, because if you are a nonprofit hospital, in order to keep your tax-exempt status, you not only have to treat people that come to the emergency room, you have to treat people that can't pay on a routine hospital admission. Now, if you're a for-profit hospital, the rules are a little bit lax, where you don't have to take everybody, but you still have to treat people who have an emergency.
Jason Lewis is a nationally syndicated radio show host and author. He believes the law is destined to fail.
I could buy an insurance plan for $10,000 and pay in and pay in and pay in. Maybe I'll never use it. Or I can pay $700 a year, pay the fine, wait till I need the insurance, wait till I get sick, and then since they can't deny me because I have a pre-existing condition, that's what I'll do. Well, that of course bankrupts the entire system.
Trygve Baney, who is a sales consultant near the Hastings area, agrees with Lewis.
Frankly, the whole thing kind of scares me. It's really just a big takeover of some of our freedom. The Supreme Court said it can be upheld, but it has to be labeled a tax. When Obama first put this out there, they promised it would be $900 billion. It's now $3 trillion. He promised not to raise taxes on middle class. Anybody under $250,000 won't see a tax increase. This is going to cost individual families $2,500 a year, minimum is what they're thinking now. So it is a tax increase. It's a huge increase.
The point of the Affordable Care Act is to make health care more available. So will the law make health care cheaper?
Well, that's the trillion-dollar question.
I think it's a huge trickle-down effect that now if people are being covered, the hospitals can lower their prices because people are going to actually have insurance.
We know that there are elements of the Affordable Care Act that are designed to reduce costs, and much of that is through reduced reimbursement to the providers of health care, but it's also looking at a lot of the waste that we have in the system. But the cost is expanding coverage to those 40 or 50 million uninsured in this country. So how that's all going to shake out in the end, it isn't clear to me, and I don't know that anybody has the answer.
I think because now we're going to allow kids to continue having health care, people are going to get their preventative vaccines, preventative care, and so they're not going to wait until they're not all of a sudden feeling good and having these stomach pains. They're going to the emergency room, where maybe we could look at those symptoms and see them before, which then if we can cure them early on, it's not going to be as expensive as if we wait till something should happen.
Baney says the law has already increased the cost of his insurance.
We were on a COBRA plan for a while, and right after this was put through and was enacted, when it came time for our COBRA renewal, our premium went up more than doubled. Healthcare itself is going to become so expensive that people are just going to not have an option but to either pay the penalty and not have insurance and just pay as they go, or pay a much higher premium.
According to Lewis, companies both large and small are going to drop healthcare insurance for their employees.
Sears Holding, Darden Industries announced that that's exactly what they were going to do. They'd give their employees $5,000, which of course they can deduct, and pay the penalty, which might be $2,000. So they're out $7,000 in labor costs. Still saves them $7,000 if the insurance policy is $14,000. So you're going to see a number of people flooding to the Obamacare insurance exchanges, which means the subsidies are going to be a lot larger than the administration planned, which means the whole bill is going to cost not $1 trillion, but probably $2, $3, $4 trillion. Nobody really knows. It's going to bankrupt the country.
One of the biggest controversies regarding the law is the possibility of rationing. This was famously disputed during the 2008 election when Sarah Palin claimed Obamacare would lead to death panels.
Well, death panels, you know, that famous Sarah Palin phrase was deliberately provocative, and I'm not altogether certain that's the best way to engage the debate. But if you get down to the point where the independent advisory board, which is a part of Obamacare, where the budget is busted, and all of a sudden the actuaries are saying, we can't afford this, it's swallowing up the budget, the independent advisory board is going to say, oh, in addition to virtual colonoscopies, we're not going to cover this and this and this and this and this.
I'm not aware of really anything in that rations care or limits care. The reality for us as a country is we don't like to say rationing, but we are going to have to ration. It's just too expensive, and those are going to be very difficult decisions.
If you look at Canada, you have to wait 3 to 6 months for an MRI in Canada. I had a knee injury. I had an MRI the same day I went into the doctor's office, instead of having to wait 3 to 6 months and walking around and injuring it even further.
Does the weekend athlete, do they need to come and get an MRI scan? A very expensive test on Monday morning. And the answer that we would have is no, that's not necessary. But if you're demanding that, we often will acquiesce to that and we will order that test for you. But the question is, at what point do you start to bear in some of the costs of that for tests that are very expensive and really may have nothing to do with your outcome?
We have a very good healthcare system here, and to turn ours into Canada's or Britain's, where people wait a long time for surgery or they wait a long time for treatment and they're denied things based upon a government panel, I don't see that being really any positive about it at all.
You're going to have people queuing up at the clinics, and other people are going to be waiting in line to get service, and I don't think it's going to be a healthier country. And there's one reason that people come to the Mayo Clinic from all over the world. There's one reason that America is a safety valve for Canada, where you've got many more procedures, many more devices in America than you do Canada, so they come across the border and they get service here. There's one reason we lead the world in medical development and pharmaceuticals is because there's a profit incentive. We actually pay people who provide this. The fallacy of a universal system is that you can get people to work for free, is you can get people to indeed take a lower reimbursement rate. We're going to cut reimbursement for Medicare patients in half. We're going to cut reimbursement for Medicaid. They already get reimbursed much lower than the private market. So the fundamental fallacy is that the left assumes people will work for free, perpetually for the benefit of the collective. People don't do that. It's not in our nature. People have a healthy self-interest. They want to work for themselves and their families, and they want to get out there and provide for the rest of the community, but in order to make their lot in life better too.
Baney and Lewis believe making the system more of a free market would be a better alternative.
Allow you to buy across state lines. You know, some states require that you have certain amounts or certain types of coverage that other states don't. And frankly, if I don't have a condition or it's not in my family that is covered in Minnesota but isn't required in North Dakota, I should be able to buy insurance from a company in North Dakota.
We haven't had a free market in health care since 1945. When we had wage and price controls at the height of the war, people don't get their homeowners insurance at work, they don't get their automobile insurance at work, they don't get life insurance at work. Why do we get health insurance at work? Because the government has set up a system through regulations and a tax code that makes that the only feasible way to pay for the system. Now, if you went back to a more of an individual market, in my view, overnight you would see healthcare costs go down. We don't hear people complaining about the price of cosmetic surgery, about the price of dentistry, about the price of all of those procedures that aren't covered by insurance. Now, why is that? Because there's a vibrant market that is driving consumers to find the best price. If you've got a third party picking up the tab, whether it's your insurance company or government, do you care what it costs? So if you change the tax code, you allow people to buy major medical policies that with high deductibles that just cover the big stuff, you're going to solve 90% of the problem. You're going to have health insurance affordable for young people, for single people, and indeed, you would even solve the pre-existing condition, because if people keep paying in the system, they don't lose it because they lost their job. You're going to have guaranteed renewability in a number of places.
Hope buttons, hope posters.
Since President Obama's re-election, we have already started to see some companies talk about making changes due to Obamacare. The CEO of Papa John's said it's common sense that some business owners would cut hours to avoid paying for health insurance. The owner of Applebee's says that he is evaluating whether or not to cut back on employees or hours in order to survive. He said the best case scenario would be only minimally reducing the workforce. One Denny's owner said that he will be adding a surcharge of 5%. Minnesota's own Medtronic warned in March of 2010 that Obamacare taxes could result in a reduction of precisely 1,000 jobs. Also, Christian-owned Hobby Lobby is currently fighting the law in court, saying it would require them to provide abortion-inducing drugs that violate their moral conscience. Their penalties could reach $1 million a day for not providing the coverage. Will stories like these become the trends of the future? Or are these the exception to the rule? Only time will tell. In Hastings, John Foss, Hastings 14 News.